it down here, and even on his lower back. So most of the pain has been eliminated. That means the blood start to move. Okay. Now I'm going to press the back. Now this is creating a feeling for the client like a Thai girl walking on his back. Okay, watch very carefully. Do it about 3 or 4 times, up and down. Okay, I do the thumb pushing one side at a time, pushing back up there. Okay, now I'm going to also show you the rolling with my forearm. This is also very beneficial for promoting the blood flow, the energy, and the heat. Okay, for this session, with the hands massage and manipulation with the muscles, is done now. Now I'm going to show you the cupping, introduce you the cupping. Now this is not the old-fashioned one. The old-fashioned one is just the cup. They use fire to burn off the oxygen and put it there. Okay, it hasn't got those old-fashioned one. This is improved one. Okay, and excuse me, I use your back as the table. Now this is the magnet. The magnet you put in there, and you turn it as create a suction like that. Okay, and depends how much suction you want to screw it tighter and tighter. Now I'm going to do. Usually when there's a painful spot there, really tight spot, I will put 1 or 2 in there. Okay, you don't need to put a lot actually. Now the way I show you, you don't need to put a lot. You've probably seen somebody doing it, all those cup everywhere, but it's not necessary. Believe me, you don't need to do that. Okay. Basically, find those knots and put it there. Okay, for about 2 minutes. Okay, 2 minutes, and get the suction until he feel is comfortable enough, not too painful. Okay, now today I will bypass that because that was already done. It's not much of knot here at the moment, so I do the what we call the running with the cup up and down. Okay, I'm going to show you how it's done. First, you need to moisturize the skin first, and I usually use the baby lotion. You don't need oil. Baby lotion is a water based. Don't put oil in it, because oil is difficult to dry and block the pores, as causing health hazard if you block the pore for a long period of time. Okay, you just rub around all those areas you're going to work on. Now the running cup, I'll use the medium size to cover quite a good area. I start from here. Okay. Feels okay? Okay. Yeah. Now you need to be reasonable tight, not too tight. It doesn't work to bring up the blood from the teeth. Now it's still a bit too easy. Make it a bit hard now. That probably the better, yeah. It may feel some tenderness, stinging. Now after a few pushing up and down, beginning to see the blues coming up. Okay, that's enough. That's done. Now, as you can see, the blues coming up, that means those blood need to be exchanged. Now, on the right side is a lot of those dead blood coming up on the top shoulder blade there. On the left side is basically down here, all those blues coming up, and some on that side, not as much on that side. So this will take 3 to 4 days to back to normal, disappear. Now what this do is to bring the dead blood from the deep, where the muscle have problems, and come up to the surface and allow to circulate, relive the blood. So the pain will be eliminated when those dead blood being eliminated. Okay, it's quite bad on here and on here. Okay, stay down for 1 minute.